Guys, this is Tanya.
Hi, this is Erin, and welcome to Wicked Psychotherapists.
So today we have a I don't want to say a classic, but I guess it kind of is at this point,
Yeah.
1999. Is that what we're terming as a classic? Yeah. Oh man, I was in high school. That's frightening. Yeah. We are going to be discussing a movie called The Sixth Sense, which you probably watched. From 1999. So we thought this had a lot of psychological elements, but also it was just an interesting story and some really good dynamics to explore. So if you've seen this or if you haven't seen it in a while, go back and watch it because I think Erin and I were both discussing we hadn't seen it in a while and it certainly was like all of a sudden things made sense. Whereas I think maybe, I wasn't paying attention or I just didn't really catch things when I first watched it way back when it first came out. So yeah, I don't know. It definitely watching it again last night, I was like, oh, everything clicked.
Yeah, it's funny because I watched it last night too, and I was just same thing. I was like, oh yeah, I know, because part of me is like, oh, I won't even have to watch this whole movie because I'm gonna remember it just from the opening scene. Nope. I
Yeah.
I remembered some of it. I remembered like some things that Cole did, but a lot of it, no, I did not remember. I did not remember a lot of the interactions at all.
Yeah, I didn't either. I know there's been a lot of things written about this because I think at the time so many people watched it and they were fascinated by this type of movie. It was kind of an innovative genre by Night Shyamalan. And I think people were just kind of confused about it. And so people wrote about it for years afterwards and kind of explained it. And I would read some of those things and I was like, I don't even really remember. Or like, I just don't think I paid attention to it. But yeah, it is.
Yeah.
I really did not remember any of it except for like a few scenes and, obviously the I see dead people, which is like the classic, line from it. But yeah, so we thought this would be interesting to talk about because it definitely has a lot of therapy elements, not only just because the main character Bruce Willis, Dr. Crowe, is he's a child psychologist, but also just the interactions that they have between him and the young boy Cole. They really kind of it's interesting to like a therapy process, and just show like what they worked through and how they work together, one being a ghost and one not.
You
But
gave it away! Spoilers! You forgot to say spoilers ahead. Sorry,
I'm pretty
guys.
sure this movie is probably the most spoilered alerted like ever. I don't know if that's a term, but it's so many people are like, "Hey, just so you know, that movie, the guy was dead all along." Like just, like that's what a lot of memes have been about. And it was, kind of, but so if you don't know that by now, you know it.
Sorry.
Yeah.
1999.
Yeah. Pretty sure most people do. But and talking about and I love Bruce Willis, young Bruce Willis here.
I forgot that he had hair. I forgot that he had hair at one time.
Yeah, he had a nice head of hair. Yeah. He's pretty handsome. Handsome man.
That must have been was that before Moonlighting or was Moonlighting before that?
Moonlighting was before that.
Was it?
I'm pretty sure. Yeah.
Because that was when we all were introduced. Well, not all of us. I mean, some of these people are like, Moonlighting? What's that?
Yeah, Moonlighting, and we look back because didn't we do a series on it? Didn't we?
On Moonlighting? No.
Yeah. Oh no, I'm thinking of the Nicolas Cage.
Oh yeah, Nicolas Cage. Moonstruck.
Yeah, I don't know why I was thinking of that. Yeah, but he was in a series with Sybil Shepherd and called Moonlighting, and he also did the Die Hard series like before this in the 80s and the 90s too.
There's always the controversy whether it's a Christmas movie or not.
Yeah, that's definitely something that I don't know. I like him, so
I like him. I like his acting.
Yeah, he's a good actor, and now it's unfortunate where he's at now. He's got like aphasia. He can't talk. He's got like like white matters disease, I think. But it's really sad to think of. But this is like in his glory days. This was so nice to celebrate him as an actor when he's really good in this. As well as the little boy Haley Joel Osment. He was like 11 at this time, and he was phenomenal.
Yeah, he was great.
Yeah, that's pretty impressive. But yeah, so we see that Dr. Crowe, he's start out in the movie, he's getting an award to be like honored as a prominent child psychologist. His wife is so proud. They're having this like lovey-dovey moment, getting some wine. The wife kind of hears something in the cellar, kind of thing, but just kind of thinks, ugh, that's just kind of freaky, whatever. And then you know, all of a sudden we realize that there was somebody there who broke in. It's a former client of Dr. Crowe's, he's an adult, some Vincent Gray, who is Donnie Wahlberg.
Yeah, like it's so creepy looking because he looks so creepy and scary, which I know that's the whole point of the character. Yeah, I thought it was, I was telling Tanya, I was like, I think that was one of the brothers or someone from 6 Feet Under, but it's not. It was Donnie Wahlberg.
He looked so different, though.
Yeah.
It's not until you really look at the picture and you're like, okay, I can see that. But like just in the scene he's playing, you would not. I didn't recognize him. I kept looking for him. I'm like, I don't see him because I saw his name in the credits at the beginning. But yeah, we had to look that up and do a little dive for that because we were like, where was Donnie?
Yeah, who was he? Yeah.
But he was, he wasn't in his New Kids on the Block,
Yeah, that's it. Yeah, it was hard for him to. He wasn't saying. He wasn't singing.
He wasn't hanging tough.
I was gonna say. Oh, Donnie,
stand tough. Oh God, no, I have that in my mind.
Now all the people with their jean jackets with the patches on the back are gonna be like, no, yeah. It's this.
And the diamond studs on it, and be like, oh, I love Donnie. I love Joey McIntyre. Oh my God.
That one's my favorite.
Yeah. Jeez, that brings back a lot of memories.
But yeah, it was very, that scene, even watching it decades later, is still so disturbing and creepy to me. I don't know why, because it's just...
It's traumatizing.
Yeah.
It's frightening. I mean, because we work with clients and, we both worked with kids, and you think you always want it. Sometimes you don't get to follow through with kids, and sometimes you think, oh my gosh, did I do everything right by that kid? And of course we try our hardest, right? But this is like a therapist's worst nightmare, right?
Mm-hmm.
Like one of them where somebody is coming back saying, you failed me, and now I'm going to shoot you and shoot myself.
Yeah.
And that's absolutely terrifying. And I mean, it's just the scene itself is just like, ugh, it just gives you like a nauseous feeling.
Yeah. And that he's just in his underwear. Really, he's underwear. He looks very disturbed and it's just really sad. So that's the beginning of the movie. It's just lots of anxiety producing feelings.
Yeah, it goes right into it. I mean, it has the lovey-dovey scene and then it goes right into it. And so that doesn't set you up very well. And you see the Dr. Crowe get shot, but then it flips to, a year later where it's like, okay, and you see Dr. Crowe just, checking in on another patient who has similar symptoms to this other client who had come in to absolutely terrorize him and, was really upset and shot him and I presume shot himself because he was holding the gun to his head. And he's like, I'm not gonna fail this client because he has the same exact symptoms of like social isolation, was kind of ousted, father's not there kind of thing, or father had passed, or, those kind of things. And that's the little boy that Haley Joel Osment plays, Cole.
Yeah.
And he's kind of observing him. It says like the next fall, South Philadelphia or something. So you just kind of see him moving on. Like you assume, oh, he survived.
Yeah.
And again, spoiler alert, he did not. But, all throughout the movie, you're thinking, okay, this guy's really trying to do right by this guy, but he's just a ghost psychologist.
Well, and then what I was thinking of too is, like, how did he get on his client list? Like, how did he end up?
I know. Oh yeah. Notes, like he's showing notes in the history and everything. I guess it's like in the ghost world, he needed to keep up his practice or his caseload. So that's what
I was wondering, like, how did he have a full file and all the past? Because he had all his past notes from people who've seen him before.
Yeah, and then, that's exactly,
and who referred him? And how did he get the referral to start seeing him?
Yeah, like, where is this coming from? Like, looking at it from that perspective, I know it just gets like brushed under the rug, but that's what we're thinking, because that's the first thing we're like, wait a minute, because we get that all through like realistic means, hopefully, right? And these are pretty detailed notes,
And he's doing his research. He's with his DSM in the back, in his basement, doing all his research after, taking his notes on his pad. Yeah, so it's...
I don't know if it was like maybe the little boy like kind of called out a need for him, or maybe it was what he needed, so he was just supplied that as a psychologist, like a ghost psychologist.
Because like when we see Cole's other ghosts that he's interacting with, they find him no matter how far they are. So maybe Dr. Crowe found Cole, in that way, and just the afterworld or whatever ended up creating the notes, the past notes for him.
They just set that up nice.
Yeah.
It's so funny because when you were, I was like, yeah, that's what I was thinking too when I was watching him on the bench across, like, from his like townhouse or whatever.
Yeah.
And he's like,
He has his
and
little
I'm like, wow, those
briefcase.
are detailed notes. Like, I don't get those in real life. Like,
Yeah.
that's not like, wow, that's pretty amazing.
Yeah, like
And they've got like all the past notes. That's
yeah,
a pretty
and it's
thorough
funny,
file.
not to jump from like another episode that we did before, but it's funny because we just did The Shrink Next Door like the other week, and we were like, what a creep. He's walking with him and he's doing all this stuff out of office. But now Dr. Crowe, we're like, what a great psychologist. He is so good. Stalking Cole across the bench, following him into the church, doing
watching him creeping up on him.
But it's in a different manner because this seems like it's more out of love and caring, and he actually wants to help Cole.
Yeah, he definitely does. And you definitely sense a feeling that Dr. Crowe truly loves his job, loves these kids, cares about them, which is why he was probably such a prominent child psychologist in life.
Mm-hmm.
And it almost sounds like his purpose in the afterlife, or kind of wherever he is, maybe in limbo kind of thing, is to be able to connect with this person, to kind of have that resolve from this situation, not only for himself, but also Cole really needs him too, because he needs to learn how to, like, I'm getting visited by dead people, and some of them are pretty scary. I mean, they're not. Some of them aren't friendly. Like, one of them leaves scratches on his back, and the other one that he sees is throwing up stuff and just creepy looking. But Dr. Crowe then teaches him skills of how to manage that, which is very therapeutic, right? Like, don't run and hide, but ask them, like, they're coming to you for a reason, And I wonder if, I just had a weird thought. I wonder if Dr. Crowe kind of had this is just totally like character made up stuff, thoughts, but if he had this feeling that, like, well, I'm coming to you for a reason, so maybe these other people are coming to you for a reason, like they have something that you can help them with. Like, he kind of had a sense about that.
I don't
And
know. Because I think he still thought he was alive at that point.
I mean, I know he definitely like thought he was alive, but I think maybe like subconsciously that was the purpose of it, like kind of to
Maybe.
say, like, I don't know. I'm like making stuff up about.
Yeah. Well, and also he
characters
was
and what they're
trying to
thinking.
heal. That was also, I was wondering, how is he able to pick up all this stuff, Dr.
Yeah.
Crowe? Like, how is he able to get those old recordings? And he was able to get his, like, he had all the cassette tapes and he was able to get them. And I thought ghosts couldn't pick up stuff. Or can they? Like, what?
Well, see, because that's from the movie, that's from Ghost. Like, we see that, like, Patrick Swayze when he's a ghost, he can't do it, but I think this was a new kind of, like, well, I'm not going to explain it, M. Night Shyamalan error, right?
Yeah, they're
like,
they can just do it. They can write notes and they can work.
I just said error instead of era. Error. That's my Boston, my word, era, I meant to say.
Yeah.
But, yeah.
But maybe that's what, maybe that's what it was. Because I think when he started listening to the cassette tape of his past patient, that's when I think he really realized Cole was telling the truth too. And I think that's when he's like, I really want to help him talk to these people and figure out what's going on. And maybe he did think he was going to heal himself too, because it seemed like after Cole helped that girl was when, again, we're jumping ahead, sorry, that he realized that he would no longer be his therapist.
Yeah, like he had guided him, he had helped him, which is very much kind of in the therapeutic process. There comes a point where you feel like your client is good to go and maybe, doesn't really need something at this point. They may come back, right, kind of thing. But it kind of seemed like a therapy closure. Kind of, it reminded me of that. And the boy was very aware of that. He was like, well, I don't think I'll be seeing you tomorrow. Dr. Crowe was aware of that too. And then the little boy helps him. He helps him because he's trying to speak to his wife. And, in Dr. Crowe's mind, he thinks it's just distance, that she's upset with him and just not addressing him. And Cole is like, when they're sleeping, you can talk to them and they'll hear you. And so he goes and he realizes, like, I can talk to her, let her know how much she meant to me. And then all of a sudden when, his wife is sleeping, the wedding ring that he used to wear falls out of her hand, and he realizes, he kind of flashes back and remembers, like, "Oh my gosh."
I'm not
And
wearing
kind of the
them.
words of the little boy, like, "They all come to me and they don't know, like, they only see what they wanna see. They don't know
Yeah.
they're dead."
Yeah.
And he starts to realize all these instances of like, "Wait, that's me, and why
Mhm.
would she have my wedding ring? Why am I not
Yeah.
wearing it? And why weren't people interacting with me?" And,
Yeah.
kind of all this stuff.
Yeah, and what a line too. Like they only see what they want to see. So like when that's happening too, Cole, that's when poor little Cole is so terrified still. Like he's so, he's like, because that was before he even told him, like, I see dead people. He's like, I'm around, people around me, they only see what they want to see. So it's very scary. And then there's this therapist ghost in your living room,
Yeah.
but
Just meeting with you to have sessions and, like, sitting across from your mother when he comes home and
yeah, just
just being like,
waiting.
"Here I am, waiting
Yeah,
for you."
we have an hour. Yeah, it is it's interesting too, because I really like the progression with Cole too, because you could tell he's so anxious and so sad and depressed and, possibly personality disorder, like just not sure. And then you realize like, no, he's like anxious and scared because all this is happening. He doesn't know how to deal with it, but Dr. Crowe helps. And then at the end, he's smiling. I love that he's like, well, even when they're pretending like, okay, well, I'll see you tomorrow. And like Cole lights up. Like, and you don't see him smile really at all throughout the movie.
Yeah. He has a very somber appearance throughout, kind of his facial expressions are very like he's scared for his life. I mean, I would be
Yeah.
too if I were seeing when a car wreck happened, the person they passed or whatever, when the car wreck, the biker or whatever comes
Yes.
up
Right now.
outside the window. And he's well aware that he's the only one that can see these people because he
Hmm.
keeps it a secret from his mom and from people around him because he knows he'll be looked at as, what he's been called as a freak, right?
Hmm.
Like he says like he gets called a freak a lot because he is in like this having this experience that nobody else is having and he has no idea how to deal with it. He's just terrified, understandably. I
Yeah.
would be as an adult. I can't imagine as a 9-year-old kid.
No, yeah, and you're having to keep it from yourself. But I wondered if the mom, at the very beginning, you see the mom, like, all the cupboards are open, and she's like, then
Mhm.
she leaves again. I
Yeah.
almost wonder if the mom has some intuition or some awareness that something is happening. Because then she's even like, Cole, was there something you were looking for? She's like, please say, like she's probably thinking, please say you're looking for something. And then he's like, let me think of something quick because I want to save mom and I don't want her to be scared. And I don't want her to think something has happened. Like, oh, I'm just looking for the Pop Tarts or whatever. So I was wondering if the mom had an idea before this, like something, because there's been some times when she's really cold and just different things. So I wasn't sure if she had suspected that.
I think she knows he's different, and I think she maybe thinks he has, like, these abilities, like telekinetic abilities or something, like, she knows something is going on, and I think it freaks her out. I think she's very scared of it, but she also doesn't really want to admit it either, but she wants him to get help, so I think she's just
Hmm.
really confused. But yeah, there probably is some sense of, like, something is not right here, like, it just
Yeah.
doesn't make any sense. She keeps saying, like, tell me," and, like, getting really upset because she knows there's something that he's
Hmm.
just, like, not quite saying or, but obviously, how are you gonna say that if, I think most kids probably wouldn't even know that that's different, but he has the awareness of it, but he's trying to protect her
Right.
from it. Yeah, he's very protective of her. And I love that part about, I know it's towards the end, but when Cole is telling his mom, he's like, "You miss her every day." You asked her a question and she said every day. And then he's like, "What's the question you asked her at her grave?" And she's like, "Oh, are you proud of me?"
Yeah.
And just gives her like that closure. So there's so many therapy elements here, like
Yeah.
giving this closure, like kind of
Yeah.
between his mom and his grandma who
Yeah.
were very close.
Well, in the one part too, which was so nice, and it did probably help heal so much trauma when the grandmother is telling Cole, we got in a fight. Your mom's father and I got in a fight, and it was right before her dance recital. So she thought I didn't attend, but I did. I was there. I was in the back. I didn't want her to see. And so just that Cole's able to share to his mom, this is what grandma said. And
Mhm.
she saw you. And you could just see that healing happen for her. And it's also happening for Cole too, because he's being believed by his mom and he's also helping his mom.
Yeah. He's got the validation of, and I think that's a big part is that of why he was feeling so outcasted was because this wasn't something that was accepted. It wasn't even something he could talk about, and he felt validated by Dr. Crowe when Dr. Crowe was believing him and trying to get him to work with it as opposed to like avoid it, and also to believe him. And then now his mom believes him.
Mm-hmm.
I think that really it looks at a lot of therapeutic elements of connection, communication, and trying not to avoid problems, but trying to process them and work with them, despite how difficult it is. But also the validation of the problem, the fact that it does exist, because a lot of people, when they come to you, they have been told a million times over that, oh, it's just this or it's that, and they've been dismissed or not listened to or told that their problems are smaller than they are.
Mm-hmm.
And so to have somebody just, see that and see you is very healing. And I think that, also I think Dr. Crowe is very open to Cole in general. He is very much like, he does want to believe him. He's not somebody who's like, I'm going to refer you to, I mean, I don't know how that would have worked, him being a ghost psychologist. I'm trying to think of how this, he would have had to find a ghost psychiatrist. He's not like, oh, I'm going to give you a med referral or whatever and just kind of dismiss it. And, which I think we've all seen done at times, maybe, maybe not with any malintention, but it kind of gets passed to the side rather than just hearing this person out and seeing like, what is their story, what is their experience? Maybe they're saying it in this way, but maybe their experience is actually this is what they're trying to communicate. This is what their story is.
Yeah.
And that very much is therapy. That's really kind of the heart of therapy.
Yeah, it is. It's a lot of almost blind faith too, and trying to, because Tanya and I talked about before the session that we kind of can understand Dr. Crowe because we're not in our client's life in the physical world a lot, being able to interact with everything that they're interacting with, but we're a part of it and we're able to guide and help them through listening and, helping them share what's happening and hopefully giving them the voice to, make the changes that they need to, or feel like they can share a part of themselves with their loved ones if it's appropriate.
Yeah. And like giving them tools to work through all those difficult times and to just have a space where people can be heard. So yeah, it very much is very symbolic. I mean, this ghost psychologist is kind of, obviously he can go to more places with him and he's got more time on his hands, but I mean, it's what it seems like. I don't know. He doesn't seem to be home very much unless he's doing research in the basement. It's, very much he's, we're kind of maybe sort of like ghosts in people's lives where we're there, but we're not necessarily present, but we're there to kind of help and guide along in a way. And I just thought that was a really good, I don't know if that was intentional by M. Night Shyamalan, but I thought that was a really good way to describe the process of therapy. And I liked that.
And I liked how, even though he I'm 5, I'm sorry. Even though he is a ghost.
But it's kind of funny though when you think about it, because it's like he's just like on the bus with him. He just like randomly appears and like he's in a chair at his home. I don't really like that. It's so creepy, but it's like it is done.
Yeah, because I was gonna say even though he's a ghost, he is following a lot of the correct methods for therapy. He's doing his research, he's sitting with him, he's doing active listening. It seems really appropriate. Like it seems depicted in the correct way. Where a lot of times you see therapists and therapy in shows or on movies or whatever, and it's just like, oh my gosh, this is nuts. But it does seem realistic, except he's, a ghost. Yeah. 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 And then I think people in real world get disappointed when they go to a psychiatrist, and I've heard this, because then the psychiatrist, they're like, my psychiatrist, I only saw them for 15 minutes. I thought it was supposed to be an hour. I'm thinking like, no, that's what you got. You have 15 minutes because they're just, unless it's the first initial appointment, it might be a half hour or 45 minutes. But otherwise, it's a 15-minute appointment for medication management, and maybe they'll order blood work, depending. But it's just, are the meds working okay? Yep. Okay. It need to change. Oh, nope. Okay. See you in a month. Yeah. Oh, that's good. Yeah. The riding on the bus with your client. Yeah. Oh, yeah. Sure. Okay. I think so. I think that's why Bruce Willis went back to the cassette tapes to listen, because he realized that he never really helped him to process or work with the ghost he was listening to. And everyone always thought he was a freak. That part of it, like, so even though he went to therapy and he worked on stuff, that was never resolved. So he might have misdiagnosed him. Maybe he diagnosed with him as a personality disorder or something like that. So he was never treated properly. So Dr. Crowe probably thought he treated him properly. Okay, saw this, I listened and gave him the right diagnosis. But then the guy who killed everyone, he killed himself, and Donnie Wahlberg. Yes. Was it Vincent Price's name? And also Vincent Price is a different person. Yeah. But so anyway, yeah, I think it was that. I think that he misdiagnosed him, and then probably Vincent went on this, real, so now he's diagnosed as whatever and being treated that way, and now he's always going to be the freak and the loser or whatever, however he is. Yeah. Right. Yeah. Yeah. And it's funny too, because I've actually seen like memes and stuff like that, like of like about like that depicting like new therapists, like, oh gosh, I wish I could contact the clients I saw when I was in, internship or whatever, and just say, whoops, I didn't learn all the tools yet, or I'm still awkwardly placing my hands, or I don't know how I'm supposed to move my face or ask an open-ended question, or am I supposed to have my hands on the chair handles, or how am I supposed to lean forward? Am I supposed to cross my legs or not? Am I supposed to take notes nonstop or listen? So it's really trying to do real world stuff and being being present. So it is a skill that you learn in school, but you also really learn it in real life with real clients, and that can take a couple years to really figure it out. Right. You're lucky. Mine not so much. I had wackadoos, but both of mine were wacky. Yeah. Okay. Oh, okay. Yeah. And I still do that. Like, I'll take notes. Sometimes, especially if it's a new person, it's like, no. Like, it's like, I'm like writing, and I'll tell them like, hey, I'm going to be writing a lot this first session. And then otherwise, other sessions will be like, I'll have the person's name, start time to end time, blah, 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 what we talk about, if there's any big quotes or anything like that. And then I'll just write the note later, like I have a electronic thing that I do it. But it's very awkward at first. It's like, what am I supposed to do? How am I supposed to word it? Am I supposed to write every single thing they say, every single thing I say? Is it, what? Yeah, it's very, no. Right. Yeah. And I have to say, I do not like the therapists who put a desk in between you. Of course, I have a desk now because I'm doing it virtual. That's something I'm always like wondering, should I sit in my chair and put a camera, or should I sit behind my desk? So that I still have that question now. Like, I'm always like having like anxiety of like, do I look okay right here? Or should I sit in a chair and then somehow set up everything so it's like I'm sitting in a chair so they see me like in a chair. So I always like I do overthink that. But I did go to a couple of therapists in the past for myself as a patient, as a client. And you go in there and and it's like them at their desk, and then you sit it's like, oh my God, you're such a jerk. I do not want to talk to you while I'm not doing a job interview. And but I also don't want to go to the therapist, and I've had the therapist who is the opposite. So you're on the couch or something, and then they're on the chair, and then they take off their shoes. And so I had this one, I was like, oh my God, why am I going to her? And she ends up taking off her shoes and stuff. And she's like, do you want a blanket? I'm like, nope, I'm fine. Just sitting here without the pillow. And I always get so annoyed at throw pillows. I always have to put them far away from me because I get grossed out thinking how many people have sat there. So yeah, I'm like, and then she's like, do you want a blanket? And so then she took off her shoes, cuddling on her thing, and she's on a blanket all wrapped up. And then she has her coffee. I'm like, what's happening? I don't want you that cozy. I am here to tell you my anxiety, and I want you present in my anxiety with me. Like, I don't want you to be like, hey, read the room. I am so anxious. I have the pillows all on the other side of the couch. I am not wrapped in a blanket, and I am not taking my shoes off. Yeah. It's all therapy. Yeah. Like, yeah. And I've also had I don't know how the therapist I have now is amazing, but I've also had therapists one time. Oh my God, this was the last session I had with her. So she ended up like, sometimes she'd bring her dog into session, which is okay. I can handle that. Like, it's like just in the room, but it's very dirty. It was like this little white, barky old dog. And so it's really smelly. Yeah, really smelly. But then one day she had the dog in there, but then one day, and and I love animals, but her cat was in session too. And her cat was in a carrier. Yeah, her cat was in a carrier in the back of the room. And she's like, you don't mind? I brought my cat here. I have to bring her to the vet right after session. She's really sick. And she kept checking on her cat throughout the session. And she also has the smelly dog in session. So I was just like, oh my God, I love dogs and I love cats. And I was like, nope, not seeing you again, ever again. So, and then I just, that was a deal breaker for me. It was just, and before that, she was fine. She was okay. Not great, but she was, right. Yeah. Yeah, and I even asked her a couple of times, like, you want to cancel a session? Do you need to go now? Because she seriously checked. Yeah, she seriously checked on the cat a couple times, and I was just like, it shouldn't be my job as a client to make sure she's okay. Just like, going back to her movie, Cole was kind of taking care of the doctor a couple times too. Yeah. No wonder he's having struggle and pretending to go to school. Yeah, I like blankets. Yeah, don't touch me. Yeah. Well, and I just think of I'm not a germaphobe, totally, but I just don't. Yeah, it is like anytime. I think I love that I do my therapy online now, and like I don't have to worry if she is, if she has 50 pillows on her couch or if she has 0 pillows. And I like pillows on my couch at home, and I'm fine cuddling with them, but I know. Yeah, I know the 4 people who have been cuddling them, but it's like not. Yeah, you did, because I've seen on my own couch when I had in person, like some of the clients would like take their feet off, take their shoes, take their feet off, take their shoes off, and then like you're like, oh my gosh, what are they doing to that pillow? Like they're just like, yeah, it is. Yeah, me too. I don't want to see them. They're so gross. Yeah, I don't care. Yeah. And then usually I'm like, oh yeah, sure. And then, but I'm always like, I don't know. I don't know. I guess I'm just a different person. I guess I know I never would do that. Yeah. And even any doctor's appointments I have that I feel like I'm going to have to get put in like a gown or a Johnny or whatever. And like, I always bring socks if I'm not, like I always like, if I'm wearing shoes that don't have socks, if I'm wearing like something, I always bring a pair of socks in my purse and just put them on for the appointments. I don't want you to look at my feet. Yeah, don't look at my feet. Yeah, I don't want to touch the floor or anything. Yeah, I guess so. Yeah, I guess it's the anxiety. Yeah. Pooping. Yeah. Please don't do it on the bathroom. Don't do your sessions on the toilet. Yes. Yeah. But again, if you're Dr. Crowe, you can do it on the bus with Cole. Yeah. Christian there. Yeah. Right. Yeah. I have heard some where some therapists will pray with their clients at the end and the beginning, even if they're not asked or if they're not, it's just, yeah. Florida. Right. Yeah. Right. Yeah. Right. Yeah. People. Yeah. I had one who discouraged me from going to grad school. And I'm like, don't do that. Like the same one discouraged me from trying to get a kitten and trying to get a puppy. Like, it's like, oh my God, don't tell me your views because, like yeah, like you're supposed to listen and guide, not tell me not to get stuff because you don't want animals or you don't. I don't know. Yeah. 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 Okay. Okay. Like fire starter, like Carrie, or not Carrie. Fire starter was fire starter. I don't know. Yeah. 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 So I don't know. I think I would like the ability to read minds, but I would like to not have it on all the time. It's also very invasive, isn't it? It's like you're, and that's not really. I mean, because then you're spying and you're lying and you're cheating. It's just like reading someone's phone all the time. It's I don't I don't know. I guess that would be my top. But I think it would be kind of cool to be able to lift stuff. Like if I wanted to just clean my house without, kind of like the Fantasia, just do 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 do, or whatever, like, or Babbity Boop, just everyone's just cleaning for me, all my brooms and stuff. Yeah. What about you? What would you like? Oh, yeah. Oh, yeah. Yeah, if we could do that, and then where you're not broken up in a million pieces, you're just like back to Norway. Yeah, that'd be nice. You could tell me how all the puffins are doing and everything. So that would be fun. Yes. Yeah. Yeah. He is he is a very hard worker though. Like he never stops. Like he's a very, very hard worker. Yeah. Yeah. Okay. Yep. Yep. We're open to documentaries, shows, movies, or even topics. Like we still do that every once in a while. Like if there's something that, you know, if there's any Winona and Cher movie that we forgot, let us know. Yeah. Next week, it won't be released for a while. We're recording next week, Mr. Deeds. So we're going back to Winona for a minute. Oh, yeah. Yeah. He's fun. So, yeah. So if you know any Adam Sandler stuff that we might be forgetting, don't worry. Waterboy's coming. Yeah. Oh, good. Yes. And keep your mind well. All right. Have a great week. Bye-bye. Stop.